I want to talk to you about a story that was in the news today, one that I find a little disheartening. If you get into the past of my studies, you'll find that about 15 years ago, and again about 10 years ago, and again about 5 years ago, I've done research pieces on vaccines and the effectiveness of vaccines. I've been asked by mothers over and over again, what's your feelings about this massive vaccines that we give our children nowadays? Are you anti-vaccine? And I said, no, it's not the fact that I'm anti-vaccine. I still have a problem with the sheer number of vaccines. Understanding that when I was a child, in my entire lifetime, I had 5, maybe 6 vaccines. My children, who are now in their 30s, had probably close to 10 vaccines. Where if you follow the full schedule the first 24 months of life with today's children, you'll find them up into the 50s. I believe the number right now is 54 in the number of vaccines. So what's going on? What is behind this mass of vaccines? So in answer to the first question, am I anti-vaccine? The answer is no. The problem that I have is if you study human physiology and you understand that as a child grows, at age 24 months, the gut-associated lymphoid tissue in a child actually is finally established, which is the site in the body where the vaccines are going to do their most good for holding on and protecting you for the rest of your life. So if we give vaccines at that age, they're going to give you their maximum benefit. If we give a vaccine at 6 months, the odds ratio of that vaccine holding for very long is rather slim. And when you look at the number of different problems that have occurred that have been linked to vaccines, in my opinion, it's not per se the mercury issue, it's not per se the vaccine issue, it's when we give the vaccines and how we do those, including a hepatitis vaccine at the first day of birth. So what brought this to my attention today was an article that came out in the New England Journal of Medicine today that was headlined, "Some whooping cough strains now are outsmarting the vaccine." Scary to me is the fact that one of the most dangerous of health issues with children is pertussis, whooping cough, which can actually be deadly. They've been recommending that parents get the whooping cough vaccine, the pertussis vaccine now, but now we're finding that the new isolated strains of pertussis that are showing up in children are different than what we're vaccinating for. We have forever treated these organisms as static. They don't change. They're going to be the same forever. Where truth be told, these are live entities that change and mutate in a self-defense mechanism. So they will spend time changing their status to self-defend themselves. And here we have an example. Whooping cough strains now outsmarting the vaccine. So your child who had a pertussis vaccine may not be protected against exposures to pertussis now. So what are you going to do? Let me just make the point, doing the basics, following our winter immune protocol year-round would be a wonderful thing to do. The attributes of adding buffered vitamin C to your children and vitamin D to your children and keeping their immune system activated that way rather than waiting. The attributes of probiotics, the dairy-free good bacteria. There's a whole world of information that we would have concerning vaccines. If you want more information, please contact us at 866-461-4536. That's 866-461-4536. You'll see the headlines. Some whooping cough strains now outsmarting the vaccine. What are we to do? If I'm a parent now, or if my advice to you is, you better get a platform in place of supporting your children, or you're going to become one of these casualties also. Good advice. You can reach us at our website, thenutritionshop.net. Thanks again for listening. We'll be back soon.